My name is Kilinyaa Cothran. I am the Assistant Vice President for Career Services and Education. I'm also an alum. I graduated in 2001. So I am very excited to be here with you guys tonight to kind of talk through some of the things that we've been working through in the Career Center. I'm going to start off on these first couple of pages just to show you some resources. With the name change, there's been some glitches in some of the partnerships that we have for online resources. So I want to make sure that I show you some of these things and then ask you that once you guys go back later on and you start going through the website on your own, if you see any issues or any dead links, please let us know. I have a student on rotation with me right now, and part of what he's been doing is going through the website and trying to make note of all those areas that we need to update due to the name change. But I think that we have been pretty successful in getting most of them taken care of. So what you should see on your screen right now is a site called Liquid Compass, and you can access this site at liquidcompass.com/UHSP. And this is our branded site. And what this site is basically a Monster, an Indeed, a Glassdoor kind of site, but it's only for healthcare jobs. So you can search this job, you can type in pharmacist, and actually it's already here because I go here all the time. But you can type in pharmacist jobs and it will pull up pharmacist jobs all over the United States or in a specific area, just really based on what parameters that you put in. Let's hope that it's going to work for me today. So I'm going to pick, I don't know, I'm going to pick New Hampshire because it's right there. Oh, there's Missouri. And I'm going to hope my internet is going to work well today because it's been a little spotty with the rain. So it will pull up a map usually of all of the jobs that you see, and you can quick apply through here. You can sort and filter here on the side based on, you know, is it a clinical job? Is it manager? Is it specialist? Who are the employers? Is it a bachelor's required, doctorate? Do you need 5 years experience, 1 year? Is it not stated? But you can do this for the entire United States. You can do it for just a specific area. And I like to do it sometimes with just the whole United States, where it'll pull up the entire country just to kind of get an idea of where jobs might be. I know we talk a lot about there being a decline in pharmacist jobs, but really what we're finding is that there's just a change, a shift in what opportunities there are. So I wanted to make sure that I shared this Liquid Compass site with you. I just put in St. Louis. So you'll see that here's 66 jobs in Missouri. And it will give you a breakdown of where they are, how far they are from where you are. If it's PRN, here's an inventory coordinator, here's intern positions. So there's a lot of opportunity to find pharmacy specific positions through this Liquid Compass website. So that is the first resource that I wanted to make sure that I shared with everyone tonight. The second resource is this site called JobScan. I'm not sure how many of you guys have actually applied for a job in the last, year or so, but you may have realized that most of these companies now use some kind of applicant tracking system. And what the research tells us is about 90% or more of companies use some kind of automated tracking system to scan applicants when they apply for a job, which means that your documents, when you submit them, have to really be on par. The great thing about this JobScan site is there's a free site, and that's what I'm showing you right now, but we also have an account with JobScan. So as the Career Center, if we're working with you or you're applying for a job and you would like to see how your resume compares to the job, then we can scan it multiple times in the Career Center because the free site only gives you so many scans before you actually have to pay. So I'm going to show you this really quickly. So here's try a sample, and what happens is it takes your resume and the job description that you're applying for, and it basically compares the two. So you'll see that it says it's scanning, it's scanning. And then what will happen is it will print out a report based on your resume and the job that you applied for. So let's see. It's performing its scan, it's thinking. And this printout will tell you a percentage of how well your resume actually matches the job. What they say is that 80% is what you really want to shoot for. And if this scan comes up here anytime soon, we'll see, because usually when they give you the sample, when it comes back at 65%. Oh, let's see. Let's see. I tried this earlier just to make sure that it was going to work for us. So it looks like the results are coming. So what you'll see is this report, and you'll see that they took the job description from the sample and the sample resume, and they actually generated this report. So this resume and job matched 63%. And you can then go through this report, and I can go through this report with you. You can go through it on your own, and it will tell you what things were missed between your resume and the actual job description. So you can put in the company's website, and it will tell you which system it uses, which is very important, because depending on what system the company is actually using, it will determine what format things need to be in on your resume. So some of these scanning systems actually want all of the tenses the same or all of the words the same. So if they use management in the job description and you have manager in your resume, it won't match that those two things are the same or that you have that experience. If the job description says vendors and you use clients, it won't necessarily match that. And depending on which system the company is using will determine whether or not you need to write out Doctorate of Pharmacy or Masters of Business Administration, as opposed to writing MBA or PharmD. So that is a really, really important ATS tip. It will also tell you like what key skills show up the most in the job description. So maybe there's some really, really important skills that they want people to have for this job, and the system knows that because of the number of times that the words are actually mentioned in the job description. So this will tell you what keywords you're missing. It'll tell you the title, how that really matches, if your education matches. Do your section headings on your resume or CV match what they're looking for in the job description? Word count, while it may not seem that important, they say that reducing your resume to under 1,000 words makes it a lot easier to navigate through these systems, because then it's not verbose. Do you have measurable results? Are there things in your resume that you can actually document an outcome for? So if you're a pharmacy manager and you increased profitability, how much did you increase profitability by? How much did you save on inventory? How much did you reduce audit violations? Those are the kinds of things that you want to include that show that you have some kind of measurable result in your resume that shows that you're capable of doing whatever this position is that you are applying for. It gives you some job level match. So are you a new grad applying for a pharmacy manager job? So maybe that's not the best match. There's some words to avoid. So it'll give you some examples. So like here it says management team player, and it gives you some guidance. So give results of a collaboration instead. Self-starter. So those are things that they might get through the interaction. So this is a wonderful, wonderful tool for you to use even as you start the job search. Hop on the free site, use it. And then if you need to use it more and you find that it's really helping you and you're tweaking your documents, reach out to us in the Career Center and we can actually use our account and help you scan it even more. The other thing that it will also do is scan your LinkedIn profile. I don't know if you caught that at the beginning. You can maximize your LinkedIn profile. So if you're applying for specific types of jobs, we know that recruiters will often look for people to apply for jobs on LinkedIn who match specific criteria that they're looking for. And I get emails all the time or little notes that say, hey, I really think you should apply for this job. So really maximizing your LinkedIn profile to make sure that you stand out for those kinds of jobs that you're looking for and that you're making connections with the right people to network is another tool that you can use on JobScan to really maximize your results. And we have a very detailed LinkedIn guide that we can share with people. I have a LinkedIn specialist come in usually 2 or 3 times a year and work with the students, and she is available for alumni too. We did some one-on-one sessions with the students, and those really, really worked well, 15-minute kind of sessions. But she put together a 68-page guide for us for people to actually walk through and really maximize their results on LinkedIn. So those were 2 things I wanted to share with you right out of the gate. And now I'm going to jump over to the website. So I'm going to close this panel. I don't see any questions yet. So this is the University of Health Sciences and Pharmacy in St. Louis's main page. And you will see that here there is a careers tab, and we are right up top. And I will tell you that Isaac, Lisa, and I really, really worked hard on trying to maximize this site so that people could use it with us or without us. But we really wanted to make sure that it was a tool that people could really get the most out of. And really, when we thought about the Career Center and how to bucket things so that people could really navigate and think about where they were in their careers, we really thought about it kind of in these 4 broad buckets: this exploring careers, and then what you do to build your brand, and then how you connect to employers, and then once you've gotten a job or you've graduated, how do you continue to grow your career as a professional? So that's really how these things are bucketed here. You will see that this first one is just about the center, and it's really just about the center staff and us there. If you want to contact us, that information is there as well. You'll see on all these pages, there's this handshake, log in the handshake, and I will encourage you and I will work with Stephanie to send out the Getting Started on Handshake guide. But Handshake is the career services platform that we use in the Career Center, and it gives students access and alumni to events that are happening on campus and in other locations. So right now there's an event there's a residency showcase that Crichton is hosting. So students have been able to have access to that and those residency programs through our Handshake account. So Handshake gives you the opportunity to look for jobs, residencies, fellowships, internships, connect with students, connect with other alums. If you are a pharmacy manager or you are an independent pharmacist or you work in industry and you're hiring, you can also post jobs through Handshake, and those are pulled into our main page as well. So I encourage you, if you do not have a Handshake account, to log into Handshake, create an alumni account, and get yourself linked to the college so that you can see all the great things that are going on campus and to make connections with students and other alumni. So really the big thing, so we're going to go to explore careers, and this is really kind of a nice bucket, if not for yourself, but even for if you know students who are looking into possible careers. There's really a lot of things here. So we do a lot of assessments. I shouldn't say a lot. We do 3 in the Career Center. So I am certified to do Myers-Briggs, strengths, and then the strong inventory as well. And those are really tools to help people kind of find their focus, figure out what works best for them, and really drive their career focus towards those goals. There are health professions resources on here. So if you're a student and you want to be a healthcare professional, but you have no idea what is involved or what opportunities there are, there's some associations that are listed here that can get you started. It also takes you through the application services. So different healthcare professions have different application processes, and this will show you those sites to help students figure out and navigate that. There are also health professions careers, pharmacy career resources. This is the tool I've been sharing with students most recently, this pharmacy careers tab. We find that a lot of students get to their almost last year in school, their P3, P4 year, and sometimes they have no clue what they want to do as a pharmacist. So this page we put together, and it actually breaks down possible careers in pharmacy. And there are probably 30 to 40 different opportunities for people to explore here. And they're broken down into areas. So you'll see community pharmacy, you'll see government pharmacy, you'll see hospital, long-term care, managed care, medical communications, pretty much any area of pharmacy you can think of. You'll see that under some of these areas, there are these links. And what we did was we took the American Pharmacists Association has a program where it's kind of like, Isaac and I call it kind of strengths and Russian roulette, because it kind of matches, you take a personality test, and it kind of matches your preferences for work environment, working with people or not working with people, and it kind of gives you a blueprint of what areas of pharmacy might be good for you. So in doing that, they took 29 areas of pharmacy in that Pathways program, and they have these, they're like 5 to 15 page summaries of those jobs. Well, what we did was we took all 29 of those and kind of boiled them down to these one pagers for people, so that you can take a look at these and see, okay, here's contract research organization. So what is that? So it'll give you a background on what the area is. It'll tell you what the people in that area, what characteristics they have. So do they have a PharmD? Do they have an advanced degree? Did they do a residency? What is the average earning potential? Are people satisfied? Do they feel challenged? It will give you some insider perspective on those particular positions. And then it'll give you these top career satisfaction indicators. What we also tried to do with all of these one pagers was also include all of the resources that we were aware of in terms of professional organizations or other publications where people could go and also get more information about those particular areas, as well as the link to the American Pharmacists Association's website for the full report. So that is there for people to use and explore. And it really is a good tool. And especially when I think about alumni, I think about a lot of us, and this was me some years ago too, are in positions where we're ready to make a change, we're ready to do something different, and we're just not really sure what that looks like. We've been doing what we've been doing for 20 years, and we're not really sure how our skill set fits into a different skill set. And really, this is a good resource to go to kind of get an idea of what's out there and what opportunities might exist for you to be able to transition to something different. So really, I would say that is like the place to go as an alum to really do some research about possibilities, especially if you're thinking about changing careers. The other big area I would say for alumni, what I find a lot when I interact with alums who come to the Career Center for help is that they've been in the same job for a really long time, and they haven't had to write a resume in 10, 15, 20, 25, 30 years. So really not sure what to put on there, what not to put on there, what format to use. So under this Build Your Brand, we have some areas. So building your brand on paper, that's getting you help with your resume, your cover letter, your CV, helping you figure out which one to use when applying to what jobs. Like I mentioned, we have that LinkedIn guide for you to use that we are really always willing to share. Visual brand. What are you wearing when you go to your interview? How are you presenting yourself? Because it's not just always about what you say and what you look like on paper. It's what are you really doing for that whole first impression. And for the students, we have a career closet where students can come and get clothes. So if you guys are ever cleaning out your closet and you want to get rid of some stuff, please keep us in mind to donate. And students have found that resource to be incredibly helpful. But if you are getting started and you need to write a resume because you haven't done one in a long time, or you're switching from a more community-based focused job and you want to do something that's more clinical and they need a CV and you got a resume but you haven't done a CV, we have templates, we have one-page guides, we have multi-page guides, all designed to help you do that to the best of your ability. And then Isaac and I are both always available to review those in any possible fashion. Like I said, in Handshake, you can connect to employers. So there are hundreds of jobs posted on Handshake for people to have access to. And I will tell you that one of the reasons I went with Handshake when we were exploring opportunities for students to be able to have a new career services platform is that Handshake has a real accessibility model. And what I mean by that is other career service platforms are set up so that each individual employer has to make a direct connection with an institution. Well, Handshake is set up so that any institution on a Handshake platform, if a company joins, then you have access to them as long as you approve them to post jobs for your institution. So it's been really nice because like a lot of people that we normally wouldn't have been in their vision because we're just a smaller school, we've had access to, we've been able to share. So like I mentioned, the other residency showcase that students have access to be able to join and access some other residency programs that probably wouldn't come to us for our program, they have access to. I've been posting jobs left and right from Pfizer. They have all kinds of different positions that our undergraduate students might be interested in. People who are transitioning from a different career at a different point in their life might be interested in. So there's just been a larger opportunity on Handshake to be able to access a more broader variety of companies than we would normally be able to access in that other model. So that is there. Grow your career. So we built the Career Center around the NACE competencies. The National Association of Colleges and Employers is the kind of premier institution for career centers in higher ed. And they have these, what they call career ready competencies that all students who graduate should be able to work in fluently. Which also means that even us that have been out in the world working all of these years should probably, do a little bit of refresh ourselves. So they're critical thinking, problem solving, communication, teamwork and collaboration, digital technology, leadership, professionalism, and work ethic, career management, and global and intercultural fluency. So those are kind of the big bucket areas. And really what we've been doing in the Career Center is looking for opportunities for those to happen organically in the classroom and outside of the classroom. And I think as I think of myself even thinking about if I was going to transition to another job, really thinking about how I perform in all of these areas would be what I was focused on, and being able to effectively communicate to a new employer that I had the ability to do all of these things. The other thing that we have is this job board. And you will see these jobs are pulled in from Handshake. So there's a couple there for some pharmacists, but a lot of them right now are just intern positions. But these are here, and then once you click on these links, these will take you into Handshake. So the job board is there. And then the other last thing I'm going to tell you guys about, because it's about 25 after and I'll leave time for questions, is that we also have another platform that is called Interview Stream. So let's say you've come to us, we've helped you build a resume, we've drafted a cover letter, we've sent it through JobScan, we've updated your LinkedIn profile, you've got your match on JobScan up to 80%, you've submitted your application, and you get called in for an interview. And oh my God, you haven't interviewed with anyone in, a very long time. We have a tool called Interview Stream, and we can set you up with an account on that. There are pre-canned interviews that are just generic 5-question, 30-minute interviews where you can actually record yourself and then send that link to someone in the Career Center. You can send it to your friends, you can send it to your husband, you can send it to, your partner, your previous boss if you want to get some feedback. And then there are assessment questions that you can answer to see, did you make great eye contact? Did you use unlike too much? Did you answer the question? Did you provide specific context? So those are all things that we can use as a tool to kind of help prepare you for the interview process. I will tell you the best thing I like is this like and counter that they have. So you record yourself and then you can watch yourself back, and each question you can play and take notes in there, and then actually count how many times you say like and in each answer that you provide. So that was a whole lot of information in a very short time. I would encourage you to go through the website, play with it, click on things. If you have a question, shoot us an email. If you want to make an appointment because you need to get your resume updated or your CV updated, by all means, please reach out to us, because that is what we are here for. And I will tell you that Isaac and I really, really have loved doing this work. And I will say that students are starting to find us and really ask questions. And we're right now helping people get fellowships going. We've been working with some alums, some recent alums who haven't had jobs for a while, who have built their skill set up now through the interview stream and the job scan, and have gotten 3 and 4 interview opportunities when before they were applying and not getting anything. So I will tell you that career services and preparing yourself for the job search is work. I would be lying to you if I said otherwise. But we are here to help you with that journey, to help you be the best that you can and put your best face forward. And please reach out to us. And if Isaac and I don't have the answer, we will do our best to find it for you or partner you up with somebody who has the answer. So do I see any questions? I don't think. This GoToWebinar is a little different than what we're used to doing. I don't see any questions. I don't see any hands. That's Stephanie's test question. Okay. Well, my contact information is on the webpage. I will work with Stephanie to get out to everybody who is on the call the handshake getting started guide. And then, like I said, please use this as a resource. I know from my own just journey that having someone to talk to, even about making a different decision, can be helpful. I know it's very scary when you start thinking about doing something different than what you've done for a long time, and that a lot of times we talk ourselves out of our ability to be able to do those different things because we're scared of change, or we're scared that we don't have the resources. But really, that is what the new Career Center is here for. And I mean, even if you just want to talk to somebody and you're not really wanting to change a job, but you just want to talk through opportunities or possibilities, that is absolutely what we are here for. And Isaac and I are having a great time interacting with alums and current students and finding opportunities for everyone. So please use us. And I just cannot thank Alumni Services enough for giving us this opportunity to interact with you guys. And hopefully we will get to do some more of these in-depth sessions